to see you.
So we have a rather remarkable speaker joining us remotely. Given COVID and given travel in China and other things, it's a little bit challenging to bring some folks in. But we have live Andrew Ng on this, who is Vice President of Tencent Healthcare. Tencent, many of you know, has perhaps the most successful web platform of platforms in the world is WeChat. It's extraordinary. It's a set of nested platforms. If I'm not mistaken, WeChat has, I believe, over 3 million micro apps embedded within the app. Again, it's third-party value creation. It's probably one of the best examples of super platforms in the world today. Alex is also responsible for Weixin mini program on health on the platform, and also Medipedia, where you can actually get advice through the system on medical advice, as well as systems offering artificial intelligence and clinical support. So you've actually added the machine learning and extra technology to improve what's happening with the clinicians and the doctor's performance. So you should know that he's actually a medical doctor that practiced in Auckland, New Zealand for a while. He also has a master's of public health from Harvard. From MIT, we won't hold that against him too much. He's practiced strategy as a consultant for McKinsey Corporation for 9 years across the United States and China. Currently also on the board of the Gates Foundation, helping manage some of the healthcare issues there. He has an honorary professorship on the Faculty of Medicine at the University of Hong Kong, and working with the World Health Organization in their health advisory. So we're getting some really honored to have some quite extraordinary insights offered by Andrew Ng. So Andrew, are you with us?
Yes.
Please,
can you hear me?
The floor is yours. Yes, we can hear you. Thank you.
Great. Can you see my slides or?
I think we can see, we don't yet see slides. In the upper right. Okay, yep, they're available.
Okay, great. I guess good morning, everyone. It's a shame that I couldn't be there in person, given COVID restriction, but hopefully through this presentation, I can talk to you a little bit about how at Tencent, how we think about healthcare and how do we actually use Weixin and WeChat to actually enhance health. It's just a bit of a backdrop. There are lots of pain points in China with regards to healthcare. For just background for those who didn't know, there's a huge commercialization of search. Search has, especially with one of competitors, Baidu, is one of their most important revenue generator. But what that has led to was a very, very unfortunate incident, what we actually call in China, Weizizi incident, where a young man has a rare form of cancer and is looking for different therapies. And he stumbled upon a lot of ads. And what ended up was that he actually went to the hospital that was buying the ads, and they were promoting an unapproved treatment. And he died as a result. Now he would have died given his condition anyway, but in the process of getting the cure that he was seeking for, he literally bankrupted himself and his family as well. And so there was actually, at that time, there's an increasing concern over the influence of search algorithms, right? Especially with regards to healthcare, where there's actually a huge asymmetry of information. And not only that, people, their willingness to pay, right, when it comes to life critical events, is actually enormous, as we all know. Now, if you take that away, anyway, within China, the offline healthcare experience is pretty awful. There's a huge imbalance between supply and demand. There's long waiting time, there's complex processes, and even the hospital environment has very little privacy. Now, because of, I guess, a confluence of those two issues, right? One is actually brought about by online behavior. The other one has been existing for a very, very long time. There has been a lot of attempts by different companies, including our key competitors, right? Where it's actually Alibaba, Jingdong, Ping An. Now, they have launched a lot of apps and programs, and there are a lot of startups, right? Which is WeDoctor and Ding Xiangyuan, the ones below, right? But what we have observed is that they have very much focused on point solutions, right? They gravitate towards what they do most well with. For example, they started off Ali Health mainly around selling drugs online as an e-pharmacy. JD is the same. Ping An, they're an insurance company, and of course, they actually went down that route with medical insurance. WeDoctor, they started off as an appointment booking system, almost like Booking.com for hospitals, right? And then they continue to work on that, and there are other telemedicine platforms, right? But when it comes to Tencent, we think about, well, there hasn't been no integrated platform, but what does that actually mean by integrated, right? What are we trying to achieve, right? There are, I guess there's a lot of theories and practices out there on what the others have done, but we took a deep look, right? Look, given what we have with Weixin in China, given the reach, given the technology, given the platform that we do, like what is actually the right way, quote unquote, right way, right, to help address some of the pain points for healthcare in China. Now, as we were mulling over this, as we were doing different pilots, we have different labs looking at, well, should we actually look at artificial intelligence, right, to help doctors improve their efficiency? Should we create a platform that connects users to doctors, to hospitals, right? Well, what would that connectivity mean when the whole market is actually very, very siloed, right? There's actually very little interoperability. There is actually a data standard for healthcare, but nobody really adheres to it, right? So with all of those offline and online issues, right, we keep mulling over what is actually the best way for we to help address some of the issues. Now, and then COVID hits. And COVID hit China really, really hard in a time where we were literally just getting started for a few months, right? Trying to beta test our Tencent Healthcare mini app on Tencent. Now, very, very quickly, we saw that there's a lack of information, especially in the early days, right? Lack of trusted information around COVID. Not only that, there's a lot of misinformation earlier on, right, around COVID that is actually leading to a lot of fear and uncertainty, not only for the people in Wuhan as they were facing lockdown, but even actually across China, Asia, and then the rest of the world, right? And I think US also witnessed very much the same, right, just a few months later. At the same time, the whole attention of the country and of the city was towards how can we actually solve medical resources shortage, right? You see there healthcare workers, right, donating themselves to rubbish bags, right, as a way to protect themselves. Now, as all of the hospitals have literally shut down or repurposed themselves to actually deal with the COVID situation, normal patients, quote unquote, normal patients with regular care, they realize that they actually don't have any more access. And a simple prescription for your heart medication, right? You cannot get it at that time. Now, can you go without it for a week or two? Yes. But in January, as we're looking down, especially for the population of Wuhan, the end is not in sight, right? What do you do? And I think this is what called us to action and start working heavily on at that time, right? Still a lot of point solution, but with a goal in mind, right? How can we bring all of that together to actually address not only the issue that we see in front of us with regards to COVID, but also in the long term, how can we solve the commercialization of search, right? Where information is heavily skewed, right, towards companies and hospitals that are buying ads. Also, how can we solve some of the offline issues, right, that will continue to bear with us for a very long time. So, and this is what we did. We created a mini program that was actually core on our platform. Now, at the peak of the pandemic, we actually have quite an amazing uptake of users, right? About 350 million MAU. Like, that has come down quite significantly, right? But as you can see, with each waves of infection within China, right? We see another sort of small peak. And now we are living around 95 to just under 100 million MAUs right now. I mean, that is still quite significant, right? Compared with the other independent mini apps on our platform, as well as independent apps, right? That you can actually download. Now, on the right, here's what it looks like. I'm going to try to go through one by one. And And not just to tell you what services we have, but why we have designed and built it this way. Now, first, what we do is the first tab that you will be able to see, right, is what we call enabling tools. And the second part is how can we actually connect online to offline services. The third portal is still incredibly important, right? Basically, all your COVID-19 live information. And last but not least, right, there's actually a lot of health information that we have built with regards to Metapedia. Now, on the enabling tools, in the long run, we know that payment is going to be important. Identification is going to be incredibly important, especially about unique ID on your health records and on your health insurance. Now, at the same time, offline in the near future will still be the predominant way most of the population will seek their healthcare. I don't think there is actually a world where we can actually have a surgery at the metaverse, right? We could actually take medication in the metaverse. So if offline is here to stay, especially for healthcare, we need to actually enable transaction. We need to enable ID. So what we have developed is actually together with the National Health Insurance Bureau, we basically launched a mobile payment for the medical insurance that allows users, right, rather than carrying before either cash or to get reimbursement later on, or physical little credit cards for them to scan, essentially electrify it and make it electronic, right? So that they can actually use this QR code for scanning offline, and that also becomes their payment model online. Now, not only is this your individual payment account, because of the nature of healthcare, we have also set up family accounts whereby families and parents can actually manage the accounts for the kids and for the parents. Because of the population mobility in China, we have now built in functionalities, right, that allow interprovincial payment and settlement. There are account balances that you need to check. And because of the population that seeks healthcare, mostly they're elderly. And we also created an accessibility version, right, where it's actually simple format, larger font, only the key functionality that allows an elderly, right, with a simple smartphone can also actually use this payment method. Now, apart from payment, there's also about unique ID. We are also working with the Ministry of Health in China to actually help co-launch what we call an e-health card. Basically, this is actually your unique ID in healthcare. Not only this, on top of it, we are trying to actually build a clinical record so that users in hospitals where they're connected, right, they can actually use this as a key to access a medical record in that institution. But at the same time, currently, a lot of the records patients keep for themselves are actually in paper format. We have used an AI OCR engine, right, to actually help users quickly digitize their test results, their examination result, so that when they actually go to the doctor again, even for those without connected records, they will be able to actually quickly show the doctors, show the physicians, right, not only their paper record, but their OCR record that has been structured data, so that they can determine trends, determine compliance to a medication, so that the continuity of healthcare is actually maintained as much as possible, even without a connected healthcare record. Now, those are some of the long-term tools that enables them to actually use both offline and online. Now, and the O2O services, again, as nothing major. Telemedicine, very similar to the platforms that you see and have used in the US, where we allow doctors to sign up, and so that users can find doctors who might not be in the same city, right, for quick consultation. But at the same time, if they want to actually have repeated consultation with the same doctor, they can do so online, and then as well as make a consultation appointment offline. On top of this, we have aggregated vaccination appointment, health check appointments that's actually been provided by providers. Now, for COVID, we've added on PCR testing and also then an online pharmacy so that they can either pick up the drugs offline or they can have that delivered to their doors. Now, the COVID-19 is our way of having curated, verified information. The only way for us to actually combat misinformation on healthcare is to have an authoritative source, if one can use that word, on what COVID means, whether it's actually only on domestic trend, overseas trends, and also important information about vaccination rates and when are we going to be reaching herd immunity at certain population groups. I think those are still incredibly useful, as in China, we took a very, very different approach, right, to managing COVID. And this information, especially the travel policies, where you can go, where you cannot go, what do you have to go under. And I think this is where we spend most of our effort at creating and making sure that our users get the most unfettered and true information in regards to COVID. Now, last but not least, health information. I mean, this is our way of addressing the first pain point that I showed in the first page. And the only way we could do it, we realized that, is that we need to build our own health education platform that is non-commercialized. That is not going to be influenced by commercial organization buying search. That's not going to be influenced by pharma companies pushing drugs, right? Essentially, we have created a medical Wikipedia that users can actually look up. It has articles, diagrams, animations. This is a lifelong work. Slowly but surely, right? We try to actually build up a comprehensive medical information database, right? That is actually free for our users to use. Not only this, we're building up patient communities so that patients can actually interact with each other on this platform. And not only for the article world, right? We are also doing a lot of live streaming, but we do the live streaming not on a UGC basis, but we invite renowned doctors to come in and talk about whether it's actually HIV/AIDS prevention, whether it's about pediatric public health, whether it's actually about cervical cancer treatment. I think there we actually run a series of streaming that users can actually subscribe to, and they can ask information, they can comment and ask questions online. We did this actually in a very, very different way. If you went through all the services that we have developed, right, as part very, very traditional portal format, if you would like, so Web 1.0. It has a platform approach when we think about from a traditional Web 2.0 perspective. But there are also a lot of decisions that we have made that ensure connectivity between online and offline, because I think the way of healthcare, I mean as a doctor, we are incredibly slow in adopting technology. But I think partly because the reality is that there will be a lot of healthcare that will remain offline. Online is only complementing an offline healthcare. I don't actually see a world where we actually will be able to replace offline healthcare with quote unquote cloud services, right? If that is actually the reality that we accept, then I think the design of Tencent Healthcare is going to be drastically different, right, from other traditional online-only platforms. So I mean, those are just a quick whirlwind on what we do. We actually do a lot more beyond what I've just presented, especially with regards to helping actually physicians, right, be more effective and efficient with AI. But I think given the topic of this summit and conference, right, I just want to give you a quick overview, right? When we say platform, when we say integrated platform, right, for healthcare, right, some of the thinking behind the design of this. So I mean, for us, our mission is still using our tech for what we call medical, right? But we actually use our connectivity for healthcare. So let me just stop here and see if I can help answer any questions. Thanks.
Very interesting. I want to say you've actually prompted a number of wonderful questions on this. So let me start with one that's just come from the online audience. I said the Chinese model seems marvelous. One of the questions might be, how would you apply this to the US system that is more fragmented? I know it's split across healthcare providers, insurance companies, device manufacturers, where there might be something less integrated. Do you have recommendations for applying these insights in a fragmented market?
Well, I think a fragmented market, I think you still see who is actually going to most to gain to actually develop this platform. Is it actually the provider or is it actually the insurers, right? And I think depending on time of the day, depending on geography, right? I think it's a bit of both, right? I think if you're in California, I think Kaiser is actually probably the best testing bed, right, to actually run such an integrated platform given their market share. In other areas, I think it will be insurers. But I think the trouble that in the fragmented market is, I think the most important is to the user. How can you maintain and aggregate and share your medical records to your right provider? Should you choose different providers, especially when mobility is actually more and more prominent, right? I think that becomes a much more important issue to actually deal with. Now, some countries like Australia, government tried to actually launch a platform, right, on personally controlled electronic health record, right? That didn't take off so well. So I think there are a lot of lessons to be learned. But if you ask me right now, I think it really depends on the microgeography. I actually don't believe, let's say, in the US, right, there could be quote unquote one platform to rule them all.
So another question is, you've done a remarkably impressive job of integrating information across scope. So COVID information, Medipedia. How is it that you identify medical information, misinformation? Who decides what's misinformation and what's accurate information?
Okay, so the way that, I think this is actually the difference, is incredibly difficult because there are a lot of user-generated content out there on the Weixin platform, right, for people to share. But we cannot stop that from happening. In some way, this is, and it's very hard to detect because it's about medical and public health logic. But so what we can do actually to quote unquote drown out potential misinformation is to have a centralized authoritative source on medical information, right? I think that's the approach that at least at Tencent Healthcare we took. Look, everything that we did has been basically verified and triple checked with our editors, with our in-house doctors, and to make sure that the information we provide on Tencent Healthcare is not misinformation. It's actually true information that we feel comfortable for me and my moms to read. And I think that's the only way. But by helping more trusted information out there. And I think that's the approach we decided to take.
So another question comes up. Have any competitors followed you along this trajectory? And have you embedded any competitors into the platform? Or asked partly differently, how does one compete with one's own app versus the ecosystem partners in there?
Yeah, and I think first of all, I think they all started, for example, Ali started off in pharma e-commerce. We took a very, very different route, right? But then I think you see people are getting closer and closer together. Like they have started adding hospital appointments, they have started adding medical information. So we see that all platforms the big platforms, right, have their own core competencies, but then they are also piloting and trying out different services that are actually beyond the comfort zone. Now, the way that we have approached here at Tencent is that even though I said that, look, there is actually telemedicine, I don't actually run it. I actually connect with other platforms that provides doctors on the telemedicine platform. In some way, it's an open platform for them to plug and play into it. For our e-commerce or for our e-pharmacy, I actually don't run my own e-pharmacy. I actually allow offline pharmacies to open up their third-party shops on my platform, right? And JD, you would say that there are other platforms. You can also access JD on our platform. So I actually tried for these services. There is actually no monopoly on service providers. So I took the approach that's very open, right? Even though I run a centralized platform, I could, if I wanted to, compete with the ecosystem, but to me, that would just be a dumb thing to do. I think the much faster way to provide better services to our users, right, is actually to leverage our ecosystem. And we have our self-service only an area where we felt that there is actually where the experience is not so good or whether there's actually a service gap. Then we will selectively go into it, but ensuring that we set the right rules and governance in place so that we do not disrupt the marketplace.
So one challenging question is that this is quite a remarkable ecosystem connecting lots of different information sources and providing huge benefits to those with access. What are there provisions for elderly or poor that might not have smartphones? How do they get access to these kinds of benefits?
Very good question. So this is what we stumbled upon very, very quickly as we were launching this. Now, I think smartphone is pretty much ubiquitous in China. Now, there is actually you have to be very, very poor for not you to have a smartphone. There are those available, but then I think the number is actually very, very little. And so when we actually launch our mini app, we want to ensure that even the lowest spec smartphone, you'll be able to use it. Now, but then there are still others that could be left behind, especially when we are transferring people away from, let's say, physical cards. The e-health insurance, the government has never actually launched a physical card once the electronic version is available. Now, does that actually put those, like you said, right, in a bind, right? Literally, what we did is, well, you can actually bind your card with your friends, with your family's phone. Once you actually gone through the authorization, what you do, you actually can print out a physical QR code, right? That's actually for your own personal use. Now, that to us is actually not the best way from a security, from a lot of standpoint, but is our roundabout way of providing a solutions, right, for those who really couldn't actually afford a smartphone, right? But I have to say, to this day, I haven't actually met someone in China, even the most elderly, right, without a smartphone. I mean, I think those are becoming harder and harder to find.
That's impressive. I have to say, when visiting China, I was impressed. Even the folks that were soliciting donations were actually having on the street, actually had smartphones. I was impressed.
Even homeless are using a QR code to receive baking payments. So,
I was impressed. So with that, I think we're out of time, but this has been quite remarkable and quite informative. So I'd like to thank you very much for your insights.
Thank you.